this webinar, specifically the cultural responses of Academy. And Max, again, thank you for your support. So I just want to share that this is a very private issue for me. So forgive me if at moments I may get a little emotional. I try not to, but I just want to dwell into this issue and bring awareness to you and hope that you get motivated and encouraged to begin addressing this silent and recognized pandemic. I believe it's a pandemic, but we're focused on the United States. So we're going to begin with focusing on this epidemic here in this country. So let's get started. And just a little content warning, the content of this webinar may be disturbing. We're going to be discussing really difficult issues like domestic violence, including traumatic brain injury, subclinical TBI or non-concussive head impacts, and progressive neurodegenerative diseases like chronic traumatic encephalopathy as they impact women, men, children, and youth. So I just encourage you, as you hear this information, please practice self-care and give yourself space. Some of the learning objectives we have for today is for, at the end of it, hopefully you will be able to describe TBI as it relates to the domestic violence population, identify the types of TBI, there's several. It's a spectrum, and we'll talk more about that. Explain what happens to the brain when it's injuring during domestic violence episodes, demonstrate an understanding the prevalence, intersectionality, disproportionality, and health disparities of TBI among the DV population, summarize the acute or primary and long-term or secondary symptoms of mild TBI, and describe how TBI symptoms affect the daily lives of impacted domestic violence victims and survivors. And thrivers, I know people have different labels and titles that they use, so I want to be respectful to that as well. So just a little bit about the terminology and why I choose to use domestic violence. Domestic violence, as you may know, is known, has many, many terms. Wife beating, intimate partner violence, family violence, women abuse, wife abuse, battered women, just a lot. Domestic violence for me feels more comfortable because it encompasses violence against also the other adults and children that are involved in a relationship. So that's why I am using that. And just a little bit about my mother. This is why I'm here, and this is why I'm doing the work that I'm so focused on now, which is my mission and my passion in life. This is my beautiful mother. And I want to remind everybody that March is Brain Injury Awareness Month. And the color for brain injury or brainness awareness is green. So that's why you see all the green in my background. So I am so honored to be speaking about my mother during this time. There's a lot of attention in the country about this issue right now, but she was a Mexican immigrant woman. She was born in a little town called Niño Jesus, where there was just no services, no portable water, no electricity. I think second grade education was the max in this little town. If you wanted to get more education, you needed to go to the main town. She passed away on July 22nd, 2015. She is the inspiration for This Hits Home. It's a documentary revealing the domestic violence, traumatic brain injury epidemic in this country and a call to action, and it's available anywhere. You could just Google it. It's streaming at several places. She's also the inspiration for Pamphila Domestic Violence Hope Foundation and other efforts that are really we're working on right now, focused on brain science and research and system-based strategies to reach health equity as we work to address this epidemic. And equally significant is that globally, my mother's case is the first public case related to domestic violence and chronic traumatic encephalopathy. She is also, at this time, unfortunately, the most severe confirmed CT case. And we're going to get more into that if you are going to be part of the second webinar and talk more about chronic traumatic encephalopathy and what that does to your brain and life. Just really quickly, I want to go over some statistics related to domestic violence, stigma, consequences, and disproportionality. So globally, there is an estimated 736 million women. Almost 1 in 3 women are experiencing domestic violence. Most violence against women is perpetrated by current or former husband or intimate partner. 275 million or 1 of 8 children worldwide are exposed to domestic violence. And just in my family, there was 7 children, and we all got abused. So you think about the adults, there's 2 adults, but there were 7 children in this system of family. The United States, just a little bit about the prevalence rates. I know maybe most of you know, but I think it's important to review them. 1 in 3, or 61 million women suffer domestic violence. 1 in 4, or 53 million men suffer domestic violence. Teens, it's really important for us to talk about teens. 1 in 11 females and 1 in 15 males report experiencing domestic violence. 1 in 6 women are first abused during pregnancy, which happened to my mother when she was pregnant. The abuse did not stop. 29 to 61% of LGBTQ plus individuals experience domestic violence. 10 to 20% of children experience domestic violence, and I think that's really underreported for lots of reasons. 49% to 71% of pets are also sadly victims of domestic violence, and they play a big role into why some individuals who are in domestic violence situations do not leave, because most of the shelters in this country do not allow for pets to come into shelters, as well as children of a certain age. So women are faced, or men are faced with the decision whether they leave or they stay. Either if they have children with varied ages, that means some of the children cannot come with them to shelter. There's just a lot of challenges with that issue. And then it's really important to see what's happening in California. So California, there's 34 or close to 35% of women and 31% of men are reporting experiencing domestic violence. 1 in 16 people experience DV in California. California ranks 35 in the US for domestic violence prevalence. The cost per victim is estimated at close to $90,000, and 31% of women in California report that their abusive partners used a gun to harm, threaten, or scare them. 58% of adults residents have been impacted by DV directly or through a close friend or relative. DV accounts for roughly 20% of all violent crimes in California. So there is a correlation between guns and domestic violence, and obviously really more severe violence, as you can see. I think it's really important for us to recognize just the disproportionality of domestic violence among certain populations. And I always think it's important to look at what is the population of the racial ethnic makeup, and then what do they represent for DV. So let's look at non-white women. They represent 59 or close to 60% of females in the United States. But for the DV prevalence, it's 37.3%. For Latinas, it's 85 or close to 19%, but they make up 29 to 37%. In some studies, up to 83% of Latinas report experiencing domestic violence throughout their life or in their lifetime. Immigrants, like my mother, 14% of the female population, but they represent 13.9 to 93% of the domestic violence population. Then we have the African-American community, Black community, which is close to 14% of females represented in the United States population, but represent 45.1% of DV, meaning that they've experienced domestic violence through their life. 7.7% of Asian and Pacific Islanders represent the female population in the United States, but represent 16 to 50% of the DV female population in the country. Then we have the American Indian Alaskan Native population, which represents 2.2% of the female population in the United States, but an astounding 84.3% of the domestic violence population. So it's, as you know, there's a huge disproportionality with this issue. And then we have the issue of Roe v. Wade, which really has increased the number of incidents of domestic violence because it's used as a way to control women and to just, it's not been healthy for women. So there's an increase in DV homicides and there's an increase in DV incidents, as I just shared. So I always think it's really important to look at where are domestic violence victims and survivors and thrivers, or if you're in a situation, where are you going? Are you seeking services? And I think it's important to look at that. So only 15% of DV victims seek help from doctors and the police. I just want you to think about that. 15%, only 15%. Less than 40% of women actively seek help in domestic violence situations. 70 to 75% of DV victims never speak about DV or seek help. More than 80% of DV victims do not receive assistance from victim services agencies. DV is not recognized in many countries. Men with abusive histories tend to be alienated, and child DV victims are often ignored. And so what keeps us quiet? I could speak for myself and my family. So it's self-stigma, you know, when someone or a group of marginalized individuals internalize negative stereotypes, attitudes, beliefs about themselves, and often because of a public stigma. And public stigma is a widespread stereotyping and labeling, negative attitudes and beliefs by the general public directed at specific group of people with a unique identity or characteristics, often leading to discrimination and avoidance. So public stigma is more of issues of shame. You feel shame about what's going on, so you don't want to talk to anybody about it, and you don't want to go get help. You also think that you can manage it yourself. You feel like you're not worthy of anything. There's fear, there's guilt, you feel not normal, embarrassment. There's so many other issues. And then we have the public stigma that adds to that. So there's a lot of victim blaming attitudes. And there's been some really high profile cases, which I think have really cemented for some women and individuals and men to really stay quiet. There's secondary victimization by providers, sometimes that say unwillingly and unknowing, some words that come out or terms that come out that could be perceived as disrespectful by somebody who's experiencing domestic violence. There's isolation, discrimination, loss of status, dismiss and denial, harsh behaviors, and again, the unprofessionalism sometimes that occurs. So the consequences of this is that really domestic violence is poorly understood. Underlying factors largely are unknown. We talked about DV stigma. DV episodes, in my opinion, and the literature are very much misunderstood. What really happens during a domestic violence episode? Hit trauma, routinely undiagnosed and unrecognized, and we're going to get a lot into that. How to best support or help somebody is, I think, still something that we need to address and look into. We have a very difficult time having deeper and courageous discussions about domestic violence. And I'm hoping that with these kinds of discussions, like this webinar, that we're able to get into deeper discussions about it. I'm having deeper discussions all over the country and all over the world. So it's challenging to develop better solutions when we're not having more courageous and deeper discussions about this issue. So domestic violence services, and I want to recognize many individuals, children, pets, men have served. I have run domestic violence shelters, some of the largest in the country. We have tremendous work has been done. The inclusive approach leaves many unserved. Excuse me, the exclusive approach leaves many unserved. There's funding and regulatory restrictions too that leave many unserved. And there's this fleeing versus trauma challenges, how domestic violence services started, which was really women fleeing situations and not really based on really looking at deeper trauma. So that's kind of how it's evolved, and it's kind of still challenging to look at what really is happening with the trauma and other things that are going on with individuals that are impacted by domestic violence. But just wanted to highlight some of these issues. So now we're going to get really into domestic violence and traumatic brain injury. We're going to go through some basic terms. So globally, traumatic brain injury is considered a leading cause of death and disability. 55 million people are living with traumatic brain injury. And in the United States, we are not tracking traumatic brain injury. It's a really difficult issue to track for lots of reasons that it would probably require a whole webinar just to do that. So it's just really difficult to track, but it is the leading cause of death and disability. 2.8 million people sustain a TBI annually. 5.3 million people, women and children and adults, are living with a permanent TBI-related disability today. Incidence rates of TBI are expected to rise, and they continue to rise annually. And it's really important to just note some of these issues with TBIs. 50% of individuals who suspect that they have a concussion or experience a traumatic brain injury do not seek care. So that's the other layer of why it's difficult to track traumatic brain injury. And we're going to get a little bit more into why it's so difficult. Traumatic brain injury, the medical cost globally, it's 400 billion annually, and in the US, the most current estimates are 76.5 billion. Those are the most current estimates that we have. And then we have disproportionalities when we're talking about traumatic brain injury, just like we have them in domestic violence. So just think about what we talked about. So who is at higher risk for traumatic brain injury? And this is where it just becomes a little bit more, the picture becomes clearer, and the challenges before us become clearer, and I think the opportunities before us become clearer. So children and youth, domestic violence victims and survivors, ethnic and racial minorities, military service members and veterans, older adults, the unhoused, and individuals in correctional or detention facilities. And I want to highlight military service members and veterans because there is a lot of attention on traumatic brain injury in that community. So there's lots of science coming out of there. But it didn't start there. It started actually with boxing. But anyways, I just wanted to highlight that. But you could see the disproportionality when we're talking about traumatic brain injury and domestic violence. If you are from an ethnic and racial minority group and you're experiencing, you have multitudes of issues that you're addressing. And we also have health disparities when we're talking about traumatic brain injuries. So for racial and ethnic minorities, they face barriers to diagnosis, care, and rehabilitation, leading to worse health outcomes. The American Indian, Alaskan Native people and older adults ages 75 and older have the highest rates of TBI-related hospitalizations and death. People with lower incomes and those without health insurance have less access to TBI care. African American and Latinx patients are less likely to receive follow-up care and rehabilitation following a TBI. Racial and ethnic minorities are also more likely to have poor psychosocial, functional, and employment-related outcomes after sustaining a traumatic brain injury. People who experience hopelessness or housing insecurity and have a history of TBI have worse overall physical and mental health and more likely to report experiencing violence or trauma during childhood, substance abuse, and suicidality. So when you're unhoused or you're on the streets, you also have a higher incidence of sustaining traumatic brain injury. So, and we just talked about that. So there's just a higher risk for that. DV-TBI victims and survivors report overall worse health outcomes. And then we have the issue of domestic violence and intersectionality. I'm not going to get really deeply into this issue, but I wanted to mention that because I want you to know that this is an issue that really has impacted my mom in our situation. I'm going to get more into this issue in webinar 3, but I wanted to recognize that it's such a critical issue. And as you know, that it helps us understand how a person's various connected identities such as race, gender, sexuality, economic privilege, migration, etc., can lead to overlapping, simultaneous, and interlocking discriminations and multiple oppressions experiences that make our situation worse. And then in the concept of DV-TBI, intersectionality can help us understand how victims and survivors' unique identities shape their experience of abuse. So what is traumatic brain injury? So traumatic brain injury is an external injury that affects how the brain works. Not all blows or jolts to the head result in a traumatic brain injury. Most brain research that we have right now is based on men in contact sports and military. And I want to really emphasize, so it's men in contact sports and the military. We really haven't done much more than that at this point. So other opportunities, right? All these are opportunities. So traumatic brain injury, they're in a spectrum. They're from mild to moderate to severe. And if you look in the literature, and if you look at if you Google it, you will not see moderate to severe be differentiated. They cluster it together. Mild TBIs are the ones that occur the most often. So most of us who are experiencing traumatic brain injury, we're in the mild category. So 80% to 90% of traumatic brain injuries are mild. So some examples, and I think when I talk about this, most people don't realize that strangulation is a traumatic brain injury, as are concussions. There are TBIs with symptoms versus ones without symptoms. Repeated head impacts include not only head impacts that lead to mild TBI or concussion that often show through symptoms, but also head impacts or subclinical TBI that do not cause the person to feel symptoms after a hit to the head. So this is a really important issue to differentiate in as you're looking at this. So it means that if you have a traumatic brain injury, especially a mild one, you may experience symptoms right away. So that's considered a mild traumatic brain injury, but we have these pre-hits or subclinical TBI where you experience no symptoms. So these smaller hits, and I'll talk more about that, but I want to make sure you understand the difference between those. So we have subclinical TBI without any symptoms, that you may have bumped yourself in the head and have no idea that your brain is forever changed. Or you have the more acute mild TBI symptoms where you experience some symptoms and you're like, okay, I think I have a concussion. So those are the differences between those. And then we have moderate to severe TBI. So the examples of those are when you have intracerebral hematoma, bleeding within brain tissue itself, like a stroke, penetrating epidural hematomology, a collection of blood that forms between the skull and the dura mater, the tough outer membrane covering the brain, typically caused by a rupture artery due to a skull fracture, like a shooting, somebody shoots you or really bangs you with something in your head. It's like the most severe ones. So brain injury and sex differences, and I want to remind you that all the research we have on this is based on men in contact sports and the military, but research consistently has shown that women sustain more brain injury than men in similar sports and may take longer to recover. So you're probably wondering why. So one of the reasons why, and again, I can't get into a lot of the detail, but one of the reasons why is that researchers believe that neck strength could have a considerable role in mitigating the damage wrought on by traumatic brain injury. So most women are not as muscular right here in the shoulder grid and neck as their male counterparts. So all this area right here. So when you hit your neck or you hit your head, it's just more tender. So research has found that female athletes' necks are 47% weaker, almost 50% weaker than men's necks. And now let's get into a little bit of the data that we have. There has been more data in the last 10 years, which has consistently kind of shown the same thing. There are cohorts within the domestic violence population that there is literally no research on this, but the research has tended to focus on women. But we have the most earlier reports of traumatic brain injury among men with abusive histories. And I want to start with that, 1989. So that's really important to note. 1989, this is when the first research started coming out, and it's been consistent since then. 60 to 90% of, and this is men with abusive histories report a history of TBI. 93% were injured prior to the first occurrence of marital abuse. 74% experienced TBI before the age of 16. For women, we've known about this data since 2001. 75 to 90% report being hit in the head by their partners, most more than once. 83% had been both hit in the head and severely shaken. 8% of them had been hit in the head over the past 20 times in the past year. So the research kind of has been consistent with what these findings have found. And then we have traumatic brain injury as it relates to children. And there's different terminology that's used, and I think that's why it's a little confusing in the literature and among professionals. In the literature, if you look at it, it's considered abusive head trauma. But I'm going to be consistent with terminology, and I want to just be using traumatic brain injury. So monitoring trends for traumatic brain injury among children is really difficult for lots of reasons. There's different, again, terms being used and definitions, and we have ethical issues, as you can imagine, especially in this field where we're talking about children who are abused, parents really fearing that there are going to be legal sanctions against them by not be as forthcoming as to why there is an injury that their child has suffered. So there's lots of factors why this is happening, but TBI is the leading cause of disability and death of children ages 0 to 5 and adolescents ages 15 to 19 years old. 1/3 of all child maltreatment deaths are due to traumatic brain injury. Children have the highest rate of emergency department visits for traumatic brain injury. 31, so just think about this, 31 to 65% of children have experienced traumatic brain injury related to domestic violence. TBI, as you can imagine, and any severity to the developing brain can disrupt a child's overall development, and it is through the lifespan. So mild traumatic brain injury is caused by an external bump, hit, blow, or jolt to the head, or during domestic violence episodes that cause the head and brain to move rapidly and quickly and forth. So let me just clarify. So it doesn't mean that you just hit your head. Somebody just bumps your head, because I think that is a myth. It's also when your body is shaken in such a way or moved or hit in such a way that your head moves, meaning that your brain is also moving in your skull. So in domestic violence episodes, and this is what I saw with my father and my mother, there was a lot of shoving, slamming, pushing, shaking, slapping, and punching, and that kind of thing. So the body was being moved, but also the brain was shaking somehow in the skull. So we're going to show you a little video. I want you to notice the skull. So this movement is called ku-kun-or-ku. The brain movement sequence is called this. Notice the space between the skull and the brain. It is minuscule. So ku-kun-or-ku occurs when a sudden jolt to the head or body causes the brain to bounce inside the skull, resulting in damage at the initial impact site. So you could see right there. And on the opposite side of the brain, the counter-ku, essentially hitting the skull twice in rapid succession due to the force of the impact. It essentially bounces around inside the skull. This motion causes the delicate brain tissue to stretch, twist, and potentially damage nerve cells due to the rapid movement, or bruise, bleed, and other forms of brain tissue damage depending on the severity of the jolt. All of this leads to chemical changes within the brain, which can result in a concussion or other TBI. So I just wanted to make sure you saw that visual. And I already talked about this, so we're going to skip through it. So mild traumatic brain injury symptoms, they can appear immediately within 24 hours, within days, or within weeks after an injury. And so that's why sometimes you hear about people that had a traumatic brain injury, they didn't feel anything, they went back to sleep, or they went and did their daily routine, but then they had really adverse effects. Some of them ended up dying because, your brain is really delicate, so we need to take care of that. So some of the acute symptoms that result immediately after a traumatic brain injury is headaches, dizziness, balance, fatigue, nausea, and loss of consciousness. The more secondary and long-term are usually divided into physical, cognitive, social, and sleep. And you could see from the physical, the light and noise sensitivity is a huge one. The dizziness and balance problems, feeling tired and fatigued, nausea, headaches, and migraines too. My mom had tremendous migraines all her life that I can remember. Vision problems, cognitive tension and concentration problems, feeling slowed down, having that foggy, groggy kind of thinking, short and long-term memory problems, trouble thinking clearly. Then we have anxiety or nervousness, irritability, and easily angered for individuals like my mom, who was a very calm person and very loving. The irritability and anger really struck out, and really just was a vast difference in her personality. feeling more emotional, sadness, and then lots of sleeping issues. So for a mild traumatic brain injury, what is recommending, and just in case you're thinking what is available right now to detect a traumatic brain injury, there is nothing. So the treatment is really to avoid a second TBI, rest for 2 to 3 days or longer, recover within a week to 3 months usually. So it takes at least 3 months, return to play, and those are the recommendations because this is sport. So return to normal activities, monitor and get care for long-term effects. So how is daily living impacted? Most people with one TBI are able to walk and use their hands within 6 to 12 months after an injury. In most cases, the physical difficulties do not prevent you from having normal activities and living independently, but it's these long-term and consequences that produces just lots of issues with weakness and problems and balance. And they may really interrupt your normal activities after the injury. Lots of fatigue. And it could also mean that you are having to really readjust your life, your employment, your daily living, lots of disruption with these long-term consequences, especially for somebody who's in a domestic violence situation where they're having multiple traumatic brain injuries. And so some of the TBI myths that we have, if you're knocked out, it's not a concussion. The reality is that about 90% of concussions do not result in loss of consciousness, excuse me, forgive me. Myth, you can return to play as soon as you feel okay after a concussion. Reality is that you should complete a multiple process to be clear or return to daily life activities. And again, these are based on sports. And this is not what the domestic violence population is looking at. But if you're in a domestic violence population, it would be a little different. You would have to really look at returning to your normal activities and taking it slow until you feel a little better. There are blood tests and brain imaging tools that can diagnose a concussion. We just said that is not accurate. There is currently nothing available that can diagnose a concussion. There's also this belief that if you wear a helmet of mouth guards, that they're going to prevent a concussion. And I want you to know, please know that I am a strong supporter of using helmets and mouth guards, but a helmet does not protect the brain. Once the brain is moving in that skull, nothing protects us. There's no helmet or anything that protects your brain. So you just have to be really aware of symptoms. Then we have the moderate to severe brain injuries, which is caused by a bump, blow, or jolt to the head during a domestic violence episodes, like kicking the head, slamming the head against appliances, floor, car, or other hard surfaces. And unfortunately, with all my work that I've done in the domestic violence population, many stories about this, many victims talking about this, and this is what they happened to them, or slamming their heads against the assault, just lots of issues. Again, the gunshots and other kind of violent actions. And what usually happens when you have a moderate to severe traumatic brain injury, you really are unconscious, you have coma and amnesia, and you're probably going to go immediately to the ER. But see some of the moderate to severe secondary symptoms: thinking, learning, motor and sensory, emotional, and behavioral. They're divided into that. So some of the things that you will see is difficult understanding and thinking clearly, communication skills really impacted, remembering information, hearing and vision problems, coordination, weakness in the arms and legs is really a huge issue. Change in sensory perceptions such as touch, feeling more emotional, nervousness and anxiety, that anger and aggressiveness coming out, sadness, depression, trouble controlling behavior, personality changes, and more impulsive than usual. With a moderate to severe traumatic brain injury, you have a 50% more chance of having seizures, 11% chance of drug poisoning, and infectious diseases, and pneumonia just multiplies very rapidly. So 50% of individuals are moderately or severely disabled after a moderate to severe traumatic brain injury. Individuals are at risk for developing progressive neurodegenerative diseases, such as CTE and Alzheimer's diseases and others. Even after surviving a moderate to severe TBI and receiving inpatient services, a person's life expectancy is 9 years shorter. Moderate to severe TBI increases the risk of dying from several causes. Again, if you have a moderate to severe TBI, most likely, if you're not able to call the doctor or the ER or the paramedics, somebody is doing it for you. Obviously, avoid a further head trauma. It usually takes 6 months to 2 years to feel better, and usually require long-term care rehabilitation. You're treating symptoms. You're not really, sadly, the science is not there where you can really put the brain back to baseline. You know, that's not available right now. Hopefully one day it will be, but you usually require long-term care and management. TBI was just recognized as a chronic disability in this country last year. So you will need long-term care and I believe also some counseling. So how does this disrupt your daily living? As we talked about all these issues that you're experiencing, you're probably not able to work as in the same job that you had, your relationships are different. So you're going to have to really modify your life tremendously. It's just a really, it really impacts your life. And then we have comorbidities, and I just want to talk really quickly about these. So severity of TBI, sex, age, health disparities, and other issues are important factors in correlations with comorbidities. So they're associated with higher risk of cardiovascular disease, and issues like psychiatric disorders, depression, bipolar, psychosis, anxiety, suicidation or suicidality, compared with unexposed individuals to traumatic brain injury. So I think that's an issue that we're struggling as within the system of care. Are you really seeing depression because you're having an individual that is experiencing domestic violence? Is it depression? Is it chronic stress? Or is it a traumatic brain injury? What is the symptom that you're seeing? What do we do with that? So I do want to take time to talk about my mother, because that is, that's where I want to focus on and to really highlight some of the things that I saw in my mother and in the journey that I've had to go through to get answers to understand what happened to her, her brain. I knew, I saw it with my eyes, but when I finally had her in my care, I was not being heard, and I'll talk more about that. So some of the symptoms my mother was experiencing, she did have non-concussive head impacts or this subclinical traumatic brain injury talked about. When I finally was able to get her neuropathology exam, that what was evident. So she had tremendous amounts of that. And I, as the eldest of 7 children, I didn't give you a little bit of my background, but I am the eldest. And so I took it on the minute I realized domestic violence was happening in my life, which is around the age of 4. I think I was younger. It was my responsibility. I took that on solely. I was the protector. So I was always looking to see how I would take care of my mom and my siblings. So I would be there trying to have my father stop. So I saw all of it, if not most of it. So I saw the concussions she suffered. I nursed her. I saw the migraine headaches that she suffered. She just suffered immense migraine headaches to the point where she would, just have a lot of nausea. She had a lot of visual difficulties, and I didn't understand that until one day I realized she was wearing sunglasses. My mom never liked sunglasses, and she was telling me it's just too bright for me. She usually liked light, and all of a sudden the curtains were all drawn in, and so she needed darkness. So that light sensitivity is really critical. So if you have an office and you have a lot of lights, and if you have somebody coming in with a traumatic brain injury, I'm wondering what's happening with that individual. So my mom had a lot of sadness and a lot of nausea. And I want to point out that my mom had a marriage to my father of over 40 years. So she sustained traumatic brain injury for over 40 years. And she never sought care. And she was never taken to be taken care of until I removed her from my father. And that's when we started getting her care. By that time, it was a whole different other situation. So my mom didn't have any recovery time. And as you can remember, when we were talking about what is a recommended recovery time for just one traumatic brain injury, it was up to 3 months. And I just want to point out in domestic violence shelters, when you're in a domestic violence shelter, If it's a crisis shelter, you can only stay there up to 30, 90 days, 120 if you're lucky. But for traumatic brain injury, you require just 3 months to recoup. So no time to recover, no time to take care of herself. And I want to also share with you that in each domestic violence episode, it doesn't last. It's not just one push. It would last sometimes for hours. So my mom was being injured with her brain. Her brain was being injured multiple times through one domestic violence episode. And you think about the 4 decades that she had. So, and I think it's important for us to recognize that what is happening during domestic violence episodes, and where was I? Well, I was also being traumatized. So it's just a lot of traumatic brain injury that women, children are experiencing during these episodes. So I just wanted to highlight why this is such an important issue, because I think that we have a lot of opportunities to really look at this, at the population, and figure out how we can address this epidemic that is silent and unrecognized to this until, and I'm hoping that I can change that and others can change that. I have amazing partners that we're really focused on this. And I also want to focus on my father. I just want you all to know that I have always and will ever love my father, and completely have forgiven him for everything that he put us through. And I've had many discussions with my dad as a little girl, and later into my adult life, consistent discussions, continual discussions, especially when I would intervene and try to protect my mother and siblings, and talk to him about, Dad, you got to stop this, you got to control yourself. And him telling me I can't control myself, I can't control those rages, I don't know what comes over me, and I'm afraid that I'm going to hurt not just one of you, but other people. So in these discussions, as you can imagine, as I got older, I realized my father also had suffered immense amounts of head trauma at the hands of his father. So I inherited domestic violence through my father. My mother's family was very loving, so she didn't recognize this issue. So he was very irritable. He had a lot of concentration challenges, a lot of nervousness, and he had sensitivity to noise and others. My father, just like my mother, and I think it was largely because he didn't realize what was happening to his brain, he also had no recovery. And my father never sought treatment for any of the trauma, the head trauma that he sustained whatsoever. Even when we were in the United States, neither one of them sought treatment for traumatic brain injury, because at that time it was just not even recognized. So anyways, that's just a little bit of background on my parents, and again, just reiterating that there were 7 children in the household, and the 7 children also experienced a lot of these issues that we were going on. We were not just exposed to it and witnessing it like the research literature says we were. I think that we have a long way to go in understanding what children go through in these situations. And I want to just remind all of you that everybody is impacted when there is domestic violence going on in a family. So the traumatic brain injury really impacted all of us, impacted severely my mother, and it impacted my father as well, and us. So that is towards the end of this one. I think we're on target for the Q&A. I wanted to allocate at least 15 minutes to ask questions or commentaries. I'm sorry if I went through it quickly, but I really wanted you to get an overview of this issue. So I'm just going to turn it over to questions that you all may have, or comments.
Well, it looks like Tammy has a question. Let me... Is it okay, Tammy, if you could ask your question in chat instead?
Max, I'm not able to see the chat for some reason. Do you mind reading it out loud?
Sure. There you go. So Tammy said, why are there so many issues with support to victims receiving victim services?
I'm sorry, what was the question?
Why are there so many issues with support to victims receiving victim services?
I think that's an issue we're going to get into in webinar 3. And I think I try to highlight that issue with the type of stigma that happens by the service provision, and then by the kind of stigma that individuals feel themselves. But in relationship to domestic violence and traumatic brain injury, there is lack of awareness of this epidemic. So when people do go get services and get help, they're not being screened for it.
Thank you. And Charity asked, is there still permanent brain damage from the emotional and mental side of the abuse?
Yeah, that's, thank you for that question. So, and this is an issue I'm going to get more into the second webinar, so I just want to highlight it a little bit here. But domestic violence is correlated with chronic stress, right? The chronic stress that you live through in navigating these situations, right? Navigating a life consumed with domestic violence. So my mom was going through an immense amount of chronic stress as we were all going through, and my father too. So lots of chronic stress. So chronic stress scientifically has been found to be linked to progressive neurodegenerative diseases. And so progressive neurodegenerative diseases are brain disorders. So you talk about chronic traumatic encephalopathy, Lewy bodies disease, ALS, Alzheimer's, et cetera, et cetera. And so once your brain is impacted, again, like I shared before, the science is not there. We cannot repair and refurbish a brain cell that's died. So yes, there is that just from the trauma of experiencing domestic violence. And then you have the TBI and all the other things happening. Thank you for that question.
Oh, sorry. In the very top, Lisa asked, have you noticed a link between substance use and TBIs also?
Yes. So there is a link with it. And the link between that is people using substances to self-medicate to alleviate some of the symptomatology. Not understanding obviously what's happening to them, because the population itself, we're not doing a good job of educating the public about what traumatic brain injury and what the symptoms are. So individuals are going to other means to self-medicate. And then, as you can imagine, as you are feeling like you're losing control of your thoughts, your behaviors, your cognitive abilities, your sleep is being interrupted, and then now your life is being impacted, maybe relationships, family, caregiving, all kinds of things. You look to that to kind of cope. So absolutely.
You. And Samantha asked, can you elaborate on the 88,000 cost of domestic violence per victim?
So that is the cost associated with like the cost of caring for somebody with domestic violence. I don't, forgive me, I don't remember if it was DV-TBI, but it's usually an estimate of how much it costs per individual. And it includes, medical care. It includes ancillary services if they've gone to get shelter. if they need food, basic services, you know, stuff like that.
Thank you. Just waiting for a few more questions in the chat. Oh, Tammy asked again, do you find issue with access to financial support denied for housing and fleeing domestic violence?
So not having, repeat the question. I want to make sure I understood it. Max, do you
Sure.
mind? Thank you.
Yeah.
I appreciate it.
Do you find issues with access to financial support denied for housing and fleeing domestic violence?
When I was working in the field, if we're talking just exclusively domestic violence, which I'm not doing now, if you don't meet certain requirements, then you don't have access to being served for those kinds of things you need, like housing. Even though the federal government does not allow discrimination against undocumented individuals, for example, they tend to not be qualified to be part of, you know, receiving services sometimes. So I think that's a huge issue. I also know for a fact that the domestic violence service provision right now is really suffering from lots of cuts. And if you look on the National Domestic Violence Hotline, they have statistics that they do every year. They do their annual count. You can get an idea of how many unmet needs go. The federal money can only go so far. So there is the number one need that women call the domestic violence hotline, and men too, because men call it too, is for housing. And the number one unmet need when you ask for services is housing. So I think in general, there's just not enough money to go around. So a lot of people are being left unserved. But then if you belong to a group that, you know, you just don't qualify for a lot of services, in many states, you're just not qualifying to get access to shelter and other kinds of things that you need. I hope that answers the question.
Tammy followed up with, I find the services being dropped and victims being used to prosecute versus helping victims.
I'm sorry, I'm not into that issue. I'm specifically focused on domestic violence and traumatic brain injuries. I don't know how to comment about that. So unless you're asking, is traumatic brain injury an issue that we should consider? Can you clarify your question, perhaps?
But I believe it's not a question. Tammy just stated that.
Oh, okay. Okay.
Mhm. I do have another question from Dr. Roslin. You were vulnerable to share your story. Thank you. Can you share how do you recommend others or how you yourself stop the cycle of family violence and what is needed?
Thank you. Thank you for your kind words. I appreciate it. How do we stop the domestic violence cycle of violence? I think, you know, I think it's up to each individual. I can only speak for myself, so forgive me. I will talk about just my experience. I don't speak for my siblings. I think every situation is very unique, very unique. So I wouldn't want to speak for others, but I know for me, as the eldest, I have very strong faith, and I got that faith from my mother. She had a lot of hope and faith. So I have a lot of hope and faith. And since I was little, literally, the minute I recognized domestic violence is part of my life, I have to get out of it. And so I was able to break that cycle, and I don't repeat it in my life. So I think for me, it's a lot of issues that happen in my life. I think as a society, there is a lot of things that we need to still do. I think there's a lot of opportunities for us still to explore. And I think it starts with having courageous and deeper discussions about domestic violence. Kind of like the ones we're having right now, and getting deeper into the issues. Before we get to the solutions, we really need to understand this issue. Housing alone is not solving domestic violence. You have to remember that when women and men and children are going to domestic violence shelters, first of all, most of them don't go to domestic violence services. They're going everywhere else. So that is also a myth, that they're only going to domestic violence services. They're going everywhere to seek services, and they're going to friends. Like, we never sought services from the formal support system. We relied on ourselves. So we have to look at this issue is where is the population? How do we reach it? Well, we reach it through churches, we reach it through like the promotoras who educate, like the community cultural leaders, with cultural humility. We reach the population that way. But they're not going traditionally to domestic violence for a lot of reasons. Very few victims of domestic violence go there. So we have to figure out where are they and how do we get this information to them? And then we allow them to speak their truths. And I hope that we also have a more humble attitude and really allow them to speak, so that we can figure out how do we address this issue. So I think there's, again, many opportunities for us as a society, and we have to think of what the current system is set up to do. You have a system right now that is not screening for traumatic brain injury, and we also have providers who are not aware of this issue, so they're not helping individuals who are impacted by it. I think my mom, when I finally got help for her, I was not heard. I was dismissed. And I have a lot of education, I have a lot of resources, and it took me many years to get answers. I have had to self-advocate for myself. So I think at the end, sometimes it falls on us as individuals and survivors to really self-advocate for ourselves, even against a system that is supposed to be there to help us, So I'm so sorry. I know I've gone on a little bit. I don't know if I answered your question. It requires such a deeper discussion that we can have, and I really appreciate the question. I appreciate your kind words.
We only have time for one more question. Alex asked, "Hi, Dr. Maria. Thank you for the presentation and sharing your personal family experience. It seems that without imaging and tests to detect TBIs, how would you say is the best way to assess for TBI? I would imagine it would be to ask directly if clients have experienced head or neck injuries or falls."
Yes, I think that's excellent. Absolutely. Since we don't have any imaging and testing or anything, that's why I said we need to really focus on symptoms. So as a provider, if you've gone through a training and now you know that this issue exists, then the second training that we should have, and I'm not doing that training, this is not to do that training, but it should be about how do you screen for it? How do you screen for it? Because you're not going to be able to treat it unless you're in the behavioral health field. You might have access to making sure that then they see a TBI clinic. There are TBI clinics in this country. There are all over the country. There's a Traumatic Brain Injury Association for every state. So it's screening for symptoms, but over the lifespan. It can be episodic and say, well, I screened them one time. No, because of the long-term consequences, those symptoms are showing up as you progress. And we're going to talk more about that in the second webinar, because for some traumatic brain injury, the symptoms show up like 10 years later. So excellent question. I appreciate it. Thank you.
All right. Thank you so much, Dr. Maria. So that will be it for today. Thank you, everyone. Just a reminder, for those who are seeking to get the CE for today, I put the post-test link in the chat. Also, Maria, if you're able to see chat, there are a lot of people saying thank you. So if you could read those, that would be great. Yeah.
Oh my God, I can't see it for some reason. I don't know what's going on. I want to thank everybody for being here. Thank you so much for hearing my story. And I hope that you're all motivated to to go out and address this epidemic. Thank you so much, everybody, for being and making time for this. I know you're all really busy.
Thank you so much. We will have part 2 again next Wednesday, same time. I'll make sure to send out the Zoom link for that to you as well. Thank you, everyone, and we'll be seeing you soon. Thank you.
Thank you.